Neurologist explains, if your nails look like this after 60, your body can be hiding 4 diseases. The profound simplicity of observing your own body can, at times, unveil the most significant insights into your underlying health. Take a moment right now to simply glance down at your fingernails, choose any one of them, perhaps your index finger, and press down firmly but gently on its surface for a full 2 seconds before releasing the pressure. Observe with meticulous care how quickly the natural, healthy color floods back into the nail bed. This incredibly straightforward action, a maneuver requiring no sophisticated equipment or specialized medical training, is precisely the technique that cardiologists frequently employ to swiftly and efficiently assess the quality of circulation within a matter of seconds. And what this humble test, alongside 3 other distinct and easily visible signs that manifest on your nails, can reveal about your cardiovascular health is information that most adults, particularly those navigating the journey past the age of 60, regrettably never have the opportunity to discover. Your nails, in their quiet and unassuming persistence, are perpetually recording the intricate daily narrative of your heart and your network of blood vessels. The critical challenge, however, lies in the fact that this invaluable language of the nails remains largely untaught, leaving a vast majority of people unaware of the silent yet crucial messages their bodies are continuously relaying. As individuals progress beyond the age of 60, a life stage often characterized by the subtle, sometimes insidious, onset of cardiovascular problems that frequently develop quietly, without dramatic or overt symptoms, until a serious event unexpectedly occurs. The unique patterns and signs etched upon your nails transform into one of the few truly accessible and non-invasive early warning systems available. This system uniquely stands apart because it does not necessitate an immediate hospital visit or a formal doctor's appointment to initiate its reading. As Dr. Ben Walker, whose professional career spans more than 2 decades dedicated to the nuanced field of preventative health for adults aged 60 and above, I am committed to elucidating 4 profoundly specific nail signs. These signs have been robustly linked in extensive medical research to significant risks, including heart attacks, strokes, and the often debilitating onset of serious circulation problems. Among these crucial indicators, the 4th sign holds particular importance, and I genuinely hope you will remain attentive to uncover it before our discussion concludes. It's a remarkably simple sign. You can effortlessly check in approximately 3 seconds, and the sheer revelation of what many people discover tends to be genuinely astonishing. Before we delve deeper into these critical insights, I invite you to share your current age in the comments section below, and to also let me know if anyone within your immediate or extended family has ever experienced a heart attack or a stroke. Your candid response to these questions will significantly underscore the personal relevance and the seriousness with which you should approach the invaluable information we are about to explore. Should you find this kind of content genuinely beneficial, empowering, and useful, a quick like on this video truly assists me in continuing to produce and share these vital health discussions with a wider audience. To truly grasp the profound significance of these 4 particular signs, especially as one enters and progresses through the golden years beyond 60, it's essential to cultivate a fundamental understanding of the intricate biological processes at play within your nails. Your nails, far from being mere inert appendages, originate and flourish from a highly dynamic structure known as the nail matrix. This matrix is a specialized layer of living, actively dividing cells nestled just beneath the proximal end of each nail, hidden mostly from casual view. These vital cells are in continuous, intimate communication with your bloodstream, effectively serving as highly sensitive biological sensors. They meticulously respond to even the slightest fluctuations in oxygen saturation levels, the overall quality and efficiency of circulation, and crucially, the health and integrity of the most minuscule blood vessels permeating throughout your entire body. Beneath the delicate surface of your nail bed lie some of the tiniest, most fragile capillaries within your vast circulatory system. Due to their exquisitely small diameter and their position at the very furthest reaches of your vascular network, these microvessels are often the very first to register and display observable signs of distress when your broader cardiovascular system begins to encounter challenges or subtle dysfunctions. For an individual in their vibrant 30s, the heart and its extensive network of blood vessels typically possess an immense capacity for reserve and resilience. The body in this phase can often masterfully conceal early-stage dysfunction or compensatory efforts for extended periods without any overt or visually detectable changes manifesting on the nails. However, as one gracefully transitions past the threshold of 60, these physiological reserves naturally begin to diminish. This reduction isn't indicative of a broken or failing body. Rather, it reflects a system that has been operating with remarkable efficiency and enduring vitality for 6 decades. Consequently, the margin for quiet, unannounced dysfunction becomes significantly thinner, making early indicators all the more critical. Consider your nail bed not merely as a decorative plate, but as a remarkably transparent and accessible window, offering an unfiltered glimpse into the intricate world of the smallest, most distal blood vessels nestled deep within your body. When these minute vessels begin to struggle under any form of physiological stress or compromise, the nails, being so intimately connected to this microvascular network, are frequently the very first anatomical site where this underlying struggle or inefficiency becomes visibly apparent. It's important to acknowledge that during a typical, often time-constrained 15-minute doctor's appointment, your physician is not necessarily going to conduct a meticulous examination of your nails. The sheer volume of critical information and examinations that a doctor must cover within such a brief window means that unless something is overtly and visually alarming, a comprehensive nail examination rarely ascends to the top of the priority list. Therefore, while this invaluable diagnostic information is certainly well established and thoroughly documented within expansive medical literature, it regrettably doesn't always seamlessly transition from the specialized clinical setting to the everyday individual who stands to benefit most profoundly from understanding and acting upon it. It is precisely this knowledge gap that we aim to bridge today, empowering you to become a more informed participant in your own health journey. Allow me to guide you step by step through each of these 4 pivotal signs. I urge you to pay especially close attention as we discuss the 4th sign, for it is truly the one that almost no one has ever been explicitly instructed or encouraged to actively look for. Our first sign to examine is a distinctive color alteration known as cyanosis. Here, it is crucial to draw an important distinction, one that most individuals have never been formally taught, yet it fundamentally shifts the urgency and appropriate response to what you might observe. Broadly, cyanosis describes a discernible bluish or purplish discoloration that becomes visible through the nail bed, often most pronounced near the base of the nail. However, there are in fact 2 distinctly different manifestations of cyanosis, and understanding their differences is paramount as they carry vastly dissimilar implications for your immediate and long-term health. The first type is referred to as peripheral cyanosis. This specific condition manifests when the bluish tint appears exclusively on your fingernails and potentially your toenails. Crucially, in cases of peripheral cyanosis, other key areas typically indicative of systemic oxygenation, such as your lips, your tongue, and the inner lining of your mouth, retain their normal, healthy pink hue. Peripheral cyanosis typically develops gradually, unfolding over a period of weeks or even months. It serves as a subtle yet significant message from your body, signaling that the circulation of blood to your extremities, your hands and feet, is not performing with the same efficiency or robustness it once did. While it functions as a distinct warning that warrants medical attention and further investigation, it is generally not considered an immediate, acute medical emergency. The second and far more critical type is central cyanosis. This manifestation occurs when the bluish discoloration is present not only on your nails, but also distinctly visible on your lips, your tongue, and the delicate mucous membranes inside your mouth. The presence of central cyanosis demands immediate and urgent medical attention as it represents a severe medical emergency. Its appearance indicates that the blood being pumped out from your heart is dangerously deficient in oxygen, a situation that necessitates prompt and decisive medical intervention. Biologically, the underlying mechanism common to both forms of cyanosis is the inadequate oxygenation of the blood reaching the affected tissues. In peripheral cyanosis, the primary issue typically resides with localized circulatory challenges, meaning blood is struggling to reach the extremities efficiently or is losing oxygen too quickly there. Conversely, in central cyanosis, the root of the problem is usually a more systemic and grave impairment related directly to the function of the heart or the lungs themselves, compromising the body's overall ability to effectively oxygenate blood before it is distributed throughout the body. Extensive medical research consistently highlights strong associations between persistent peripheral nail-bed cyanosis and a range of concerning cardiovascular and pulmonary conditions. These include the often insidious early stages of heart failure, specific types of heart valve problems that can remain undiagnosed and progress quietly for decades, and various chronic lung diseases that over time place an increasing and ultimately unsustainable strain on the heart's ability to function effectively. The profound relevance of this particular sign for individuals over the age of 60 cannot be overstated. The prevalence of heart failure, for instance, exhibits a sharp and concerning increase with advancing age. It stands as one of the most frequently underdiagnosed conditions within the older adult demographic, often lurking silently beneath the surface. Early-stage heart failure, in particular, frequently fails to trigger dramatic or overt symptoms. There might be no sudden crushing chest pain, no alarming collapse. Instead, there is often just a gradual, quiet, almost imperceptible decline in the heart's overall pumping efficiency. The body, with its remarkable capacity for adaptation, will compensate for this declining function, often for extended periods, until its compensatory mechanisms are finally exhausted and can no longer sustain the necessary physiological balance. To illustrate this with a practical example, let me share a composite patient story reflecting countless presentations I've encountered over the years. This involves Frank, a retired postal worker from the sunny climes of Sarasota, Florida, who was in his mid-70s. For nearly a year, Frank had vaguely noticed that his nails seemed to possess a slightly purplish tint at their base, a phenomenon particularly noticeable in the mornings or after prolonged periods of sitting still. He, like many, attributed this to a variety of innocuous factors: the occasional dip in temperature, what he considered just a part of getting older, poor circulation, and his lifelong tendency to always run cold. It wasn't until his sharp-eyed daughter, visiting from out of state and well-versed in health matters, casually commented on the unusual color of his nails that he felt prompted enough to bring it up during his next routine checkup. His doctor, demonstrating commendable diligence and an understanding of age-related risks, performed a thorough examination and, based on this observation and Frank's age, wisely ordered an echocardiogram. This non-invasive diagnostic test, which uses sound waves to create images of the heart, unveiled the presence of early-stage heart failure, a condition that, while serious, was fortunately still highly manageable through the timely initiation of appropriate medication and carefully tailored lifestyle adjustments. Frank's early detection almost certainly prevented a hospitalization that, given the typical progression of undiagnosed heart failure, would have been nearly inevitable within the subsequent year, dramatically altering his health trajectory for the better. This story underscores the power of a simple observation and an informed conversation. The practical takeaway from Frank's experience and the understanding of cyanosis is remarkably straightforward and empowering. Make it a deliberate practice to examine your nails regularly, ideally under conditions of good natural daylight, such as near a window, rather than under artificial light which can distort colors. If the color near the base of your nail bed appears persistently bluish or purplish, and this discoloration does not recede or change even after your hands have thoroughly warmed up, as cold can temporarily restrict blood flow, this is an observation of significant merit. It absolutely warrants bringing to your doctor's attention. Specifically, when you discuss this with your physician, inquire whether an echocardiogram, a non-invasive ultrasound of the heart, might be a prudent diagnostic step given your age and any other relevant risk factors you may possess, such as a family history of heart disease or existing conditions like high blood pressure. And as a crucial and urgent warning, if you ever observe a bluish discoloration not only on your nails, but also distinctly on your lips or tongue, do not hesitate for a scheduled appointment. This particular combination signals a potential medical emergency, indicating a systemic lack of oxygen, and you should seek immediate medical evaluation without delay, for example, by going to an emergency room. Have you yourself ever noticed any unusual color changes in your own nails? I encourage you to type the word heart in the comments section right now if you would be interested in a comprehensive deep dive video specifically dedicated to at-home warning signs of heart failure that you can easily spot. I personally review every single comment, and the topics that generate the most engagement and interest are consistently prioritized for future content. Moving on to our second crucial sign, brittle, slow-growing nails. This is arguably one of the most commonly dismissed indicators, with almost everyone over the age of 60 tending to rationalize it away as merely an inevitable, benign part of the aging process. What I am referring to here encompasses nails that persistently break with ease, that exhibit a tendency to peel into distinct layers like delicate parchment, that split vertically along their length, often creating jagged edges, or simply those that seem to have significantly decelerated their growth rate compared to their past vigor. Perhaps you once needed to trim your nails diligently every 2 weeks. Now it feels as though they barely change from 1 month to the next, requiring trimming only infrequently. The biological explanation for this phenomenon is rooted deeply in the health of the nail matrix. When you observe consistently brittle, slow-growing nails, it indicates that the nail matrix, that vital living factory of new nail tissue, is not consistently receiving the robust supply of essential nutrients and oxygen-rich blood that it critically requires to produce healthy, resilient, and robust new nail tissue. One of the most prevalent and often overlooked reasons for this compromised supply in older adults is a condition known as peripheral artery disease, or PAD, often referred to simply as poor circulation. Peripheral artery disease is a systemic condition where the arteries responsible for transporting oxygenated blood to your extremities, your arms, your legs, and crucially, your hands and fingertips, become progressively narrowed and hardened due to the insidious buildup of atherosclerotic plaque. And here lies a piece of information that most individuals are never explicitly told, yet it is profoundly important. The very same type of atherosclerotic plaque that, when accumulated in the arteries of the heart, leads to devastating heart attacks, and the identical plaque that, when deposited in the arteries supplying the brain, precipitates strokes, is the same kind of arterial plaque that builds up and narrows the blood vessels leading directly to your fingertips. The critical implication is this: the presence of significant plaque buildup in one artery, particularly in the periphery, strongly suggests the likelihood that similar plaque is forming or has already formed in other vital arteries throughout your body. This systemic nature is precisely why peripheral artery disease is considered one of the most potent and reliable predictors of future heart attacks and strokes. Individuals who receive a diagnosis of PAD carry a significantly elevated risk of experiencing major cardiovascular events compared to their counterparts without the condition. And what surprises most people is that PAD often progresses silently for many years, offering no dramatic symptoms until the disease has advanced considerably. It is truly a silent killer in many respects, making early detection through subtle signs even more critical. However, there is a distinct and often overlooked pattern of warning signs that tends to appear in conjunction, and recognizing this specific combination holds far greater diagnostic weight than identifying any single symptom in isolation. This crucial pattern is as follows. You observe consistently brittle, slow-growing nails, often accompanied by changes in their texture or tendency to split. You also experience cold hands and feet that remarkably take an unusually long time to warm up, even in comfortably warm room temperatures, suggesting sluggish blood flow to the extremities. And finally, you notice a recurring sensation of cramping, aching, heaviness, or even numbness in your legs when you engage in walking, particularly when ascending hills or climbing stairs. Crucially, this leg discomfort, known as claudication, tends to subside and resolve completely when you stop and rest, as the demand for blood flow temporarily decreases. This last symptom possesses a specific clinical designation. It is known as claudication, and it stands as one of the most reliable and telling indicators of significant arterial narrowing in the lower extremities. If you find that you are experiencing all three of these seemingly disparate symptoms concurrently, the brittle nails, the consistently cold extremities, and the leg cramping that reliably emerges with walking distance and just as reliably resolves with rest, that particular combination is genuinely a strong signal that warrants a detailed and proactive conversation with your physician. To provide a vivid illustration, consider the composite patient story of Eleanor, a woman from Burlington, Vermont, who had dedicated her entire adult life to her passion for gardening. When her nails began to noticeably become brittle and split with disheartening ease in her late 60s, she, like many, naturally attributed it to the cumulative effects of years spent with her hands deep in the soil and to the harsh, dry Vermont winters. She earnestly experimented with various nutritional supplements, diligently applied nail-strengthening treatments purchased from the drugstore, yet nothing seemed to offer any lasting improvement. The pivotal change that finally prompted her attentive doctor to investigate more thoroughly was a detail Eleanor mentioned almost as an afterthought during a routine visit. She casually remarked that her legs felt persistently heavy and somewhat fatigued when she walked uphill, something she noticed had been subtly but steadily worsening over the preceding 18 months. Her doctor, connecting the dots of her seemingly minor complaints, performed a simple yet highly informative test called an ankle brachial index, or ABI. This non-invasive test compares the blood pressure measured at the ankle to the blood pressure measured at the arm, providing a crucial ratio that indicates arterial health in the legs. The result unequivocally confirmed the presence of moderate peripheral artery disease. Empowered by this early diagnosis, Eleanor embraced aggressive lifestyle modifications, initiated a structured walking program tailored to her condition, and began taking the appropriate medications to manage her risk factors. Through these concerted efforts, she succeeded in dramatically reducing her cardiovascular risk, effectively averting potentially severe future events and preserving her mobility. Her brittle nails, though initially dismissed as a cosmetic issue, had been the very first observable sign, quietly narrating a critical health story for nearly 2 years before her condition was finally identified. The practical takeaway here is empowering and actionable. If you have noticed a distinct and measurable increase in the brittleness of your nails over the last 1 to 2 years, and concurrently experience any sensation of unexplained heaviness, cramping, or fatigue in your legs that reliably occurs when you walk, particularly when navigating inclines or stairs, then it is imperative to proactively ask your doctor about an ABI test. This test is simple, entirely non-invasive, and remarkably effective at detecting peripheral artery disease at a stage where timely intervention can make an enormous life-altering difference in preventing serious cardiovascular complications such as heart attack, stroke, or even limb loss. It's a small step that can yield huge benefits. Now, let's turn our attention to the third sign, which I referenced at the very beginning of this discussion. This is the one I genuinely encourage you to actively perform alongside me right now as we speak. Our third sign is known as the capillary refill test, and its execution is astonishingly swift, taking less than 5 seconds to complete on yourself. Here's how to conduct it effectively and accurately. Begin by holding your hand at the approximate level of your heart to ensure consistent blood flow. Select any fingernail you prefer. The index finger is often a convenient choice due to its accessibility. Using the thumb of your opposite hand, press down firmly but gently on the chosen nail for a duration of approximately 2 full seconds. As you apply pressure, you will observe the nail bed momentarily turning white as the blood is temporarily pushed out of the dense network of tiny capillaries nestled directly underneath. Now, release the pressure and immediately begin counting 1001, 1002. Observe closely and carefully how rapidly the normal, healthy pink color returns to the nail bed. In a healthy adult with robust circulation, that vibrant pink hue should reappear in consistently under 2 seconds. If, however, it consistently takes 3 seconds or longer for the color to return, especially if this slow refill time is observed across multiple fingers, this is a noteworthy sign. It suggests that the smallest blood vessels within your body are not refilling with blood as quickly or efficiently as they should, indicating potential circulatory sluggishness. There is also a valuable complementary test you can perform in conjunction with the capillary refill test, one that medical professionals often find immensely useful in gaining a fuller picture. Gently press the back of your hand against your forehead or your cheek. In a healthy circulatory state, your hand should feel approximately the same temperature as your face, indicating balanced body temperature regulation. If, despite being in a comfortably warm room, your hands consistently feel noticeably cooler than the rest of your body, this serves as an additional, subtle marker indicating potentially reduced peripheral circulation. Performing both of these simple tests together provides a much more comprehensive and nuanced picture of your microvascular health than either test could offer in isolation, as they assess different aspects of peripheral blood flow and temperature regulation. Biologically, the capillary refill test is a direct measurement of the speed at which your microvascular system, that intricate, vast network of the tiniest blood vessels throughout your body, recovers and replenishes itself after being subjected to transient pressure. A persistently slow capillary refill time indicates that the circulation within these crucial small vessels is sluggish or compromised. Extensive research has consistently linked persistently slow capillary refill in adults over the age of 60 to a spectrum of significant cardiovascular concerns. These include a reduction in overall cardiac output, meaning the heart is pumping less blood than it should, indicating a less efficient pump, undiagnosed atrial fibrillation, a common heart rhythm disorder characterized by an irregular and often rapid heart rate, and an elevated risk of stroke. The microvascular system, with its delicate and extensive network, often serves as an early barometer for cardiovascular trouble. This is because these small vessels possess considerably less reserve capacity and are more vulnerable to early changes in blood pressure and flow than the larger, more robust arteries, making them like the canary in the coal mine for the circulatory system. It is an important note, however, to avoid undue panic if your refill time falls into a borderline range, perhaps around 2 to 3 seconds. This alone is typically not an immediate cause for alarm, especially if your hands are cold at the time of the test, as cold temperatures constrict blood vessels, slowing refill, or if you are currently taking certain medications. Some commonly prescribed blood pressure medications and beta blockers, for instance, can slightly prolong capillary refill time without necessarily indicating an underlying problem, as they are designed to affect heart rate and blood vessel tone. To ensure the most accurate result, repeat the test in a warm room, ensuring your hands are comfortably warm. If, even under these optimal conditions, your refill time consistently remains at 3 seconds or longer across multiple fingers, then this observation becomes genuinely meaningful and warrants further discussion with a healthcare professional. The profound importance of this particular test lies in its capacity to provide you with immediate, actionable health information, utilizing nothing more than your own hands. You don't need to consult a doctor, acquire specialized equipment, or even schedule an appointment. You simply need approximately 5 seconds of your time and adequate lighting. Consider a composite scenario that powerfully illustrates the diagnostic value of this simple test, involving Walter, a retired postal worker from Topeka, Kansas, in his early 70s. Walter had coincidentally watched a similar health tip on a daytime television program and, out of curiosity, decided to try the capillary refill test on himself one evening. To his surprise, he counted nearly 5 full seconds before the normal color returned to his index finger. Intrigued, he repeated the test on his thumb, then his middle finger, and then on his other hand. The result remained consistently the same, indicating a systemic issue. The very next morning, he contacted his doctor's office, calmly describing his observations. His doctor, recognizing the potential significance, asked him to come in for an appointment and performed a comprehensive cardiovascular workup, including an EKG. This thorough investigation revealed that Walter had undiagnosed atrial fibrillation, a prevalent and often silent heart rhythm problem that is one of the leading causes of stroke in older adults due to the formation of blood clots. Walter was promptly started on appropriate anticoagulation therapy, which, according to current cardiology literature, very likely prevented a major, potentially debilitating stroke within the subsequent 12 months. His simple at-home test truly saved him from a devastating event. The practical takeaway here is not just to understand the test, but to actually do it. Right now, before you conclude watching this video, take the time to perform the capillary refill test on at least 3 different fingers on each hand. Crucially, ensure you do this in a comfortably warm room with warm hands to eliminate any confounding effect of cold temperature on the results. If your capillary refill consistently takes 3 seconds or longer across multiple fingers, make a clear note of this observation and actively bring it up during your next medical appointment. Specifically, inquire whether a comprehensive cardiovascular evaluation, which might include an electrocardiogram, EKG to check heart rhythm, and possibly an echocardiogram to assess heart structure and function, would be an appropriate next step given your findings and personal health history. I invite you to share in the comments section right now how many seconds your capillary refill took. I genuinely read every single reply. And before we delve into our 4th sign, the one I've described as almost universally unknown, if this video has provided you with valuable insights thus far, a quick thumbs up truly makes a difference in ensuring this crucial health information reaches a wider audience who needs it most. Finally, we arrive at the 4th and arguably most overlooked sign, the one I've specifically saved for this concluding position due to its profound yet unrecognized importance. Our 4th sign involves observable changes to the lunula. For many individuals tuning in right now, the word lunula itself might be entirely unfamiliar, a term they've never encountered in the context of their health. To locate it, simply direct your gaze to the base of your nail, right at the very bottom, just above where your cuticle begins. Do you perceive a small, distinct whitish crescent shape, almost resembling a miniature half moon? This crescent is precisely what we refer to as the lunula. It represents the visible segment of your nail matrix, the very part where new nail tissue is continuously being formed in real time. Despite its crucial role as a visible window into nail health and broader physiological processes, the lunula stands as one of the most consistently overlooked yet highly accessible diagnostic signals in the entire human body. Here's a vital piece of information about the lunula that most people are never made aware of. The pattern of which fingers display visible lunulas holds as much diagnostic significance as their mere presence or absence. In a healthy adult, it is almost universally expected that the thumb and the index finger will exhibit a clearly discernible lunula. The middle finger typically also possesses one, though it might be slightly less prominent. The ring finger sometimes displays a lunula, and it is entirely common and considered within the bounds of normal variation for the pinky finger to often lack a visible lunula. Therefore, if your pinky finger appears to have no visible lunula, but your other fingers do, this observation is generally not a cause for concern. What is genuinely concerning, however, is when this established pattern undergoes a noticeable change from your personal baseline. This includes instances when lunulas that were previously clearly visible on your thumb and index finger have inexplicably disappeared, when the lunulas across all your fingers have become significantly faded or barely perceptible, or, crucially, when the inherent color of your lunula has shifted to something distinctly different from its normal, healthy, pale white hue. These color shifts, in particular, are remarkably telling and can each point towards different underlying physiological issues. For example, a reddish discoloration of the lunula has been linked in various clinical research studies to conditions such as congestive heart failure and certain rheumatic conditions that have an inflammatory impact on the heart's tissues. A bluish tint to the lunula can suggest the same critical oxygenation and circulation problems that we explored earlier in our discussion of cyanosis, indicating a lack of oxygenated blood. Conversely, a very pale lunula that has almost faded into the surrounding nail, becoming indistinct, can be an indicator of anemia, a condition characterized by a deficiency of red blood cells or hemoglobin. Anemia, while seemingly unrelated to the heart's direct function, has its own significant and often profound connection to cardiovascular strain, as the heart must work harder to circulate oxygen-poor blood throughout the body to meet its metabolic demands. The reason this particular sign earns its final and most emphatic position in today's discussion is precisely because the lunula remains an element that almost no one is ever taught to examine with diagnostic intent. Yet, it represents one of the most readily accessible and consistently visible biological signals your body offers. Most individuals have simply never been instructed to scrutinize the base of their nails for anything beyond a simple infection or injury. Consequently, a subtle yet potentially life-saving sign, one that could have prompted an early and crucial conversation with their doctor, often goes entirely unnoticed and unaddressed for years, silently allowing underlying conditions to progress to more serious stages. Consider a composite case that I find particularly instructive, involving a grandmother named Dorothy, a vibrant 72-year-old from Asheville, North Carolina, who had enjoyed generally robust health throughout her life. During a casual phone conversation with her daughter, who happened to be a registered nurse, Dorothy mentioned, almost as a playful aside, that the little white half-moons on her fingernails seemed to have vanished. She couldn't even recall when she had last seen them, highlighting the insidious nature of gradual change. Her perceptive daughter, recognizing the potential significance of such a subtle change, gently but firmly encouraged her mother to bring this observation up at her next physical examination. Dorothy, somewhat reluctantly, did so, admitting she felt a bit silly, mentioning her nails to her doctor. To her credit, her physician took the observation seriously, ordering a complete blood count, CBC, to check for anemia and a comprehensive cardiovascular risk assessment. The blood work revealed significant anemia that had been developing slowly and insidiously over time, leading to fatigue and strain. Concurrently, the cardiovascular workup unearthed early, subtle signs of strain on her heart, likely exacerbated by the anemia. Both conditions, once identified, were promptly addressed with appropriate interventions before they had the chance to progress to a point where they might have precipitated a major, life-threatening event. The change in her lunulas was the very first observable sign, a silent harbinger that could have easily been missed for another 2 or 3 crucial years had her astute daughter not encouraged her to voice her seemingly trivial observation. The practical takeaway concerning the lunula is elegantly simple. Make it a routine to examine your thumbs and your index fingers specifically, right now, under excellent natural light. if your lunulas are entirely missing across most of your fingers, if you've noticed they have noticeably diminished in size or prominence in recent years, or if their characteristic pale white color has undergone a significant shift, these are observations that are worth bringing to your next medical appointment. Specifically, when you consult your doctor, ask for a complete blood count, CBC, to assess for conditions like anemia, and request a comprehensive cardiovascular risk assessment to evaluate your heart health more broadly. Now that we have meticulously covered all 4 of these vital nail signs, allow me to provide you with a comprehensive, practical framework for effectively utilizing this newfound knowledge. Because, as we all know, merely possessing information and actively transforming it into meaningful action are 2 fundamentally different endeavors, and my goal is to decisively close that gap for you. Begin your journey of proactive self-assessment today with a simple, deliberate act. Take both of your hands to a window where abundant natural daylight pours in, providing the best light for observation. Methodically examine each individual nail. Carefully note the overall color of your nail bed. Observe whether you detect any subtle bluish or purplish tint, especially at the base. Pay attention to whether your nails feel unusually brittle or if their growth rate appears to have significantly slowed. Then, diligently perform the capillary refill test on at least 3 different fingers on each hand, timing the return of color precisely. Finally, scrutinize the base of each nail for the presence of the lunula, noting which fingers display a visible crescent and which do not, and whether their color seems normal. To aid in tracking gradual changes, an invaluable practice is to take a photograph of both of your hands. Maintaining a visual record over time is genuinely useful because subtle transformations that occur gradually can be remarkably challenging to recall accurately from memory alone, and photos provide an objective comparison point. This very week, if any of the signs we have discussed today resonate with or match what you observe on your own hands, make it a point to write down your findings in a clear, concise manner. Specifically, note the particular sign, precisely which finger exhibited it, and your best estimate of how long you have noticed this change. Bring this detailed written note with you to your very next doctor's appointment. This preparation will facilitate a more productive and informed conversation. Furthermore, within the next 30 days, if you observe 2 or more of these signs appearing together in combination, do not passively wait for your next annual physical examination. Take immediate action. Call your doctor's office, clearly and concisely describe what you have observed, and specifically inquire whether a nurse can perform a quick phone triage. This will help determine if you need to be seen sooner than your scheduled appointment, potentially preventing a condition from worsening. Most importantly, and I cannot stress this enough, please refrain from attempting to self-diagnose based on any single sign in isolation. The true diagnostic value lies in the comprehensive clinical picture, which encompasses your complete medical history, your current medications, any other symptoms you may be experiencing, and, crucially, what your doctor discovers during a thorough professional examination. The overarching purpose of today's detailed discussion is to empower you, to transform you into a more informed, articulate, and proactive participant in that vital conversation with your healthcare provider, not to replace the indispensable expertise and judgment of medical professionals. This information is a tool for advocacy, not for definitive diagnosis. Here is the overarching message I want to leave embedded deeply within your understanding. Your body is an extraordinary, sophisticated system that has been communicating with you, sending you a ceaseless stream of signals, some overt and unmistakable, others quiet and nuanced, every single day of your life. The truly remarkable and empowering aspect of being over the age of 60 is that you possess an unparalleled wealth of context, a profound depth of lived experience, and greater access to sophisticated medical support than at virtually any other juncture in your life. The 60s, the 70s, and indeed the decades stretching far beyond are emphatically not a period when meaningful and impactful health changes suddenly become impossible. On the contrary, extensive and consistent medical research unequivocally demonstrates that early detection, coupled with informed and attentive awareness of these types of subtle biological signals, can dramatically and positively alter health outcomes, even in the later, richer decades of life. The nails you glanced at this morning, perhaps dismissing them as entirely uninteresting or purely cosmetic, may well represent the most accessible and profound diagnostic window your body has graciously provided you. You simply needed to acquire the knowledge of how to